Welcome back. You're watching Africa Speaks. As promised, on this side of the show, we're going to talk about a very serious issue, and that is childhood cancer awareness. And this is the Childhood Cancer Awareness Month. And we're going to focus on some very interesting data that is even concerning about the number of cases that are recorded every year. Apparently, every year in Kenya alone, we have 3,200 diagnoses that are recorded. And this is an underestimate because it is the professionals feel like perhaps there are those who are outside the access to medical cover, medical access, medical treatment, and therefore are not being documented and suffering silently outside this bracket of people who are able to get to hospital and get this diagnosis. So to shed more light on this particular conversation, I am joined this afternoon by Dr. Doreen Karimi, who is a pediatric oncologist, and she's going to shed light on these numbers, why we should be concerned, and what are some of the cases of cancer that affect children that we should be looking out for. Perhaps you're a parent, you have kids, the child is having symptoms you don't understand. Maybe you should be tuning in to this conversation to learn more and be able to arrest certain situations. Thank you so much for joining us this afternoon.
Yeah, thank you so much for having us again.
Okay.
I know we've done this show before, but it's always a pleasure to be here to raise awareness about childhood cancer.
Yeah.
And this is a very special month for us as oncologists because it's a golden month. This is the month that we've picked out, and we raise a lot of awareness about childhood cancer. It's, gold is actually the color for children, because they are precious.
Yes, indeed. Now, let's just start off from what I said, the data that is coming out. Speak to us about that, and what does it say to you as someone who is attending to children with cancer?
And you rightly said that we diagnose about almost 3,300 new childhood cancer cases every year. But when you look at what we have, because our cancer registries are not very active, especially in terms of reporting childhood cancer cases, we look at population modeling statistics, and what they say is that we should be diagnosing about 6,000 to 7,000 new childhood cancer cases in Kenya.
Wow.
All right? So that means it's about 50% of our children who actually don't get a diagnosis, and they die without ever getting to even have an attempt to treatment. Now, the story is also not very rosy for the other 50% that we are diagnosing, because 70 to 80% of these children appear with very advanced disease. And you notice that is stage 4, stage 3, and the staging is actually very important in terms of prognosis. So this again has resulted to most of our patients having very low survival rates. And why are we concerned? It's because childhood cancer in high-income countries is actually very treatable and curable. They have treatment rates, success rates of up to 80% and beyond.
Is this because children are more resilient than most adults? Why is the success rate really high?
Actually, that's a fantastic question. And the reason is early detection and diagnosis saves lives. So whenever we pick out children as quickly as possible, get to the right diagnosis, and I say right diagnosis because a lot of these children are misdiagnosed to have many other things, and right diagnosis and get appropriate therapy started, then we have a chance to cure them, and that is possible even right here in Kenya.
Absolutely. And from what you're saying, what I'm getting from you is that they're basically children that go undetected, or perhaps just getting treated for all manner of things, malaria and all that, to the point that they lose their lives without even knowing what's happening to them?
Yes.
Wow.
That's true. So you find, unfortunately, childhood cancer doesn't have any specific signs that you'd say, if I see this, then this means my child has cancer. And that's why it's very easily misdiagnosed or undetected, and most people actually land on it and they're very shocked. Even parents are very shocked when you get to diagnose their child to have. But we have some things we call early warning signs
that we can look out for.
Yes, of childhood cancer. And this is something that I'm very happy you're giving us this opportunity to raise that public awareness, because we notice that there is a very low level of awareness, not only with our healthcare providers, frontline healthcare providers, but also with the public. And we want to let you know what should you be looking out for, that will tell you possibly look for a second opinion.
Right.
Or this is time for me to go back again and have my doctor check me out.
Okay, before we jump into that, because I'll pair that up with the common cancer cases that affect children, I'd like to know what sort of groups are being left out of the loop when it comes to early diagnosis and early detection. Are they in informal settlements? What parts of Kenya, what kind of family is this potentially going to be affecting?
So unfortunately, again, also childhood cancer affects a lot of people who have who have the lower socioeconomic status, and possibly because if you have a job and you're in the city, you're probably better educated, you're likely to be accessing health facilities that are likely to diagnose your child. But when you look at the common mwananchi that we're talking to, it's a lot of them even don't go to hospital. They probably will try an over-the-counter remedy before thinking of going to hospital.
Handling a fever and headache as opposed to...
Exactly. So by the time they really think of let's get some help in a health facility, it's already so much time wasted. And then also when they come in and our frontline healthcare workers are not able to pick it out quickly, then that again results to wasted time, and then they have late presentation, advanced disease, and poor survival.
So you're talking about the social economic issues that are affecting this, but at the same time, we are also having maybe public health service providers not very keen or not able to really pinpoint what the problem is. So, I mean, now getting to symptoms of what a parent should do, then what should you do? Because perhaps your kid has a persistent fever, for example. You've tried everything you can to contain it. It's not working out. You go to your hospital. Then they're not really telling you what it is. Treating maybe, it could be malaria, let's treat this or let's treat that. So what could you say to a parent that is watching that will give them a better chance at being able to focus and get their children the right kind of treatment?
So childhood cancer is a rare disease. And what that means is you as a parent, as a caregiver, or as a health worker, you need to have a high index of suspicion. And I always say whenever symptoms, treating malaria is actually very easy. Once you have a diagnosis, it's not that hard. Treating typhoid is actually quite easy. Constipation is very easy to treat. So symptoms that persist, symptoms that seem to either be increasing in intensity over a period of time is always a good time to come back again to the health system and say, my child is not better. Can I have you have a second look? And really to encourage healthcare providers that don't get tired of these parents who keep coming back. Because that is how you're actually going to be able to think again and have treated for malaria. It's not getting better. What's happening next? Maybe this is a child, if I can do more tests, do them at that point, or if not, at least refer them early to a healthcare facility that they can be investigated appropriately and a second look is given or a second opinion is given.
Right. So are there other ways to be able to have red flags when aside from a persistent symptom? So persistent symptoms, there are some symptoms that might point you and tell you for sure there's something happening that is not correct. For example, when you see a child who comes in and there is a swelling somewhere, and this swelling has been there for a week, you've tried some antibiotics given by your doctor and it doesn't disappear, then that's time for us to take a little action. Whenever a child wakes up crying, in the night, anything that wakes you up in the night always requires to be investigated. And there are some things like, for example, a new squint. You know, your child's eyes were beautiful, and now all of a sudden you have a squint happening. It's a new symptom. You can't quite tell what is going on. That's a time to actually look for a doctor, because it could be a sign of a brain tumor, or it could be a sign that you have a cancer in the eye. We call retinoblastoma. Most of the time, children are not really going to be losing weight for any reason. So if you find a child who is losing weight and you know you're feeding them right, that's a time to actually ask this
healthcare provider, what's happening with my child? Most of them even sweating a lot in the night is a very common symptom for tuberculosis, and which is very common in our setting. But also, I say tuberculosis it's very easy to treat it. Within 2 weeks, you have some good response, and you can be able to tell this is not cancer, right? So that's why we say anytime as a healthcare provider or as a caregiver, your gut feeling tells you something is wrong with my child, go and seek for help. Better to seek it early and you're told nothing is wrong, you don't have to worry, but seek help and seek early.
And you know, I feel like it's particularly challenging for parents because the child probably isn't able to articulate where it's pinching, what kind of pain they're feeling, so you really are groping in the dark. But aside from the symptoms, speak to us about the more common cancers that you see among children.
So the more common cancers we see are the acute leukemias, and leukemia is really a blood cancer. Those constitute about 20 to 25% of the cases we see. Then we have the lymphomas. Lymphomas are also part of the immune tissue, cancers of the immune tissue. We have the brain tumors also. Tumors in the eye, we call it retinoblastoma. For some reason in sub-Saharan Africa and low and medium income countries are quite common. And then we have the kidney tumors, which we call Wilms tumor. And last but not least, it's really the tissue, the cancers that involve the supporting structures, which are called sarcomas.
All right. Now, I know there's always the issue of lifestyle and what people are doing that is causing them cancer. But when we're talking about babies, they haven't lived long enough to indulge in something long enough to catch or to develop a certain condition. So explain to maybe a parent who's watching and wondering, maybe is there a lifestyle thing? Is it genetic? What is it that they can also be aware of in terms of what would put their child at risk?
That again is a fantastic question, because once you start looking for modifiable risk factors like lifestyle issues, then you were looking at prevention. And that's a question I get over and over again. Daktari, could I have prevented my child getting cancer? And I say, unfortunately not. Childhood cancer is not associated with any risk factors in terms of lifestyle. And so you don't have to worry. There's nothing you did wrong. And you alluded to something called the genetic. And really a lot of it is really about the genetics of that child. And maybe an infection might have triggered it. Some of the tumors that we treat are triggered by an infection, but largely we don't know what causes childhood cancer. And that's why for the adult cancers we talk about prevention in terms of screening. But if you invest in screening childhood cancer, you'll end up wasting all your resources and you might not pick a lot. And then in terms of also prevention, there's probably nothing you can do to prevent. So what is the key message? Early detection, early diagnosis is what will save life.
And what are some of the ways that the healthcare systems can be used to help in this, in attaining what we're talking about, early detection?
So one of the things that we are all up about is really raising awareness. And awareness both from the public side, where we are talking and you can hear there are so many viewers who get to view this and get to hear that at least there's something called childhood cancer. And one, the childhood cancer is curable. If detected early, appropriate therapy is available in Kenya, and we can cure these children and they go on to live very normal lives. Then two, we really also need to improve in terms of our diagnostics, because sometimes we blame these caregivers or parents, but we realize they've been in the health system, they've been coming to seek for help, but we are disappointing them because we either don't have the tests, or we don't know how to refer, or we probably just wasting too much time doing unnecessary tests that they might not help. So improving in terms of our diagnostics, and then really knowing, where do I send this child, because it's not every hospital that should or is treating childhood cancer. So knowing where to refer, and there's so many facilities in the public health system and in the private health sector that are already treating childhood cancer, and it's just a phone call or simple messaging somebody and they can be able to direct you where to go.
You work with Gertrude's Hospital.
Yes,
I do. About some of the programs and initiatives they have in place for such.
So we have a childhood cancer initiative we did in partnership with the Ministry of Health and Kenya Childhood Cancer Trust, and we were able to actually train almost about 200 frontline healthcare workers in different county hospitals, and that was extremely eye-opening to discover that most of our healthcare workers actually are not able to notice that this child has cancer. So it was empowering to actually leave them with some tools they can be able to look at, some charts to be able to know that childhood cancer is there, but more or less also avail ourselves that if you have a question, if you suspect, you don't have to just wallow in your misery and say, oh, we can't diagnose this. There's somebody you can reach out to. Then other than that, our foundation has actually been also working extremely hard and looking even for partners, global and locally, to see how can we be able to provide care in terms of diagnostics, assist especially children from needy backgrounds who can get a CT scan, an MRI to be able to conclude their diagnosis. We pay for that, and also be able to sponsor some of the children through their cancer treatment at the hospital.
Absolutely. And I mean, this is a very important conversation, and it's a month long meant for awareness, and thank you so much for shedding light on some of the issues surrounding childhood cancers. But the key takeaway from this definitely is early detection is key.